The honourable member for Lacombe.
Thank you, Mr. Speaker. Elder abuse is not something to take lightly. We entrust our loved ones to the care of competent and compassionate care workers in seniors' homes across Alberta. At AHS's Lacombe Hospital, families spoke up, but issues persisted until nursing students in practicum reported abuses. The teacher had to pull the students from the hospital before an investigation was launched. Such drastic measures should not need to be taken before reports of abuse are taken seriously. Why were families rebuffed, and why did it take so long for an investigation to be launched?
Excellent question.
The honourable minister.
Thank you very much, Mr. Speaker, and the member's right that Albertans of all ages and all healthcare needs deserve to be treated with dignity and respect. And again, I want to thank the students at Red Deer College for expressing their concerns and ensuring that those were raised. As soon as AHS found out, the concerns were indeed followed up. With regard to the specific questions about families notifying the facility, I'd be happy to follow up. I can tell you that when AHS was notified, they immediately followed up, and I'd be happy to coordinate sharing more additional information. Any Albertan can call 811 to talk to a registered nurse and absolutely be facilitated with the right people if they do have concerns they want to raise, Mr. Speaker.
This is a systemic issue, given that 80 continuing care service standards have been breached at Lacombe Hospital. No medical assessments at admission, no care plans, no record of legal representatives, no fall assessments, no dietary assessments, no wound care interventions. Staff are not trained in infection prevention, emergency preparedness, medical assistance, care with dementia, CPR, on and on. How did this facility deteriorate to the point where 80 care service standards have been breached?
Good question.
Honourable Minister.
Thank you very much, Mr. Speaker. The member does articulate concerns that have been raised. As I've mentioned, there is an investigation. And even more deeply than that, Mr. Speaker, ensuring that the 75 residents in the facility had their health care needs being met was the #1 action, as well as making sure that the 3 staff leads who were on at the time and who were responsible, Mr. Speaker, were put on lease. The three staff leads at the facility, Mr. Speaker. So I have to say that this is a demonstration of the seriousness that's been taken. With regard to the accusations, the review is continuing, Mr. Speaker, and of course any measures will be taken to ensure the safety of all residents, Mr. Speaker.
Second supplement.
People's parents and grandparents are at stake here. Given that patients have suffered falls, burns, and serious systemic substandard care here, if this is the case at one facility, I can only guess at how many other facilities managed by AHS are in the same disastrous state. Given the people of Lacombe are worried that this will be swept under the rug, will the minister make the results of the current investigation into the hospital public to ensure the real corrective action is taken?
Honourable Minister.
Thank you, Mr. Speaker. And certainly what is always the case is that whatever information can be shared publicly will be done so, Mr. Speaker. We want to ensure the safety of all residents in this facility and others. That's why there are regular audits, Mr. Speaker. And that's why I really want to say again that if you have any questions, please do raise them with AHS and make sure that they are properly flagged, as was the case by these nursing students, Mr. Speaker. I'm very grateful that they did raise these concerns. I myself had a grandmother who lived in long-term care for 5 years. There were times where she fell, where I had concerns, where I was able to raise them, and they were able to be addressed, Mr. Speaker. And of course, the staff who work in this facility deserve our respect, Mr. Speaker.